in what we do in dealing with incontinence, pelvic floor dysfunction, neurogenic bladder, the multidisciplinarity is really key. I mean, this is not the urologist alone, or the gynecologist alone, or the neurologist alone, or the PMR physician alone who will deal with all the problems those patients have. We really need to have this group of several disciplines together, and to me, the ICS is the only meeting worldwide where you have all these international renowned experts and all these passionate people about those problems gathering together in one place for several days and discussing all these issues.
I'm very excited to be able to host everyone coming to the ICS in 2023 in Toronto, Canada. It's an amazing international city, easy to get to, safe and clean, with lots to offer.
The annual meeting is the place to meet with other colleagues, not only with urologists, but also gynecologists, physiotherapists, nurses, and other specialists interested in the field. So it's a unique exchange of information, not only from the clinical perspective, but also you will get the most recent update in terms of research in the field.
We have some amazing speakers who have agreed to come and speak this year at ICS. A couple of the sessions that I'm really looking forward to, we're having a big session on pelvic pain, which can be really complex to treat. The other one is we're having an amazing session on sexual dysfunction. Patients are a little bit nervous to sort of discuss it with their provider, whether it's a physician, nurse practitioner, their physio, their nurse, and so there's an amazing lecture that can give you some great information about this topic that we don't really discuss too much.
I have the pleasure of presenting one of the state-of-the-art lectures. So there's been a lot of discussion recently about a potential link between anticholinergic medications for the bladder and dementia. So the idea is to get out there and say, this is what we really have, this is what we really know, and here are the things we may need to know in the future.
I always enjoy the podium presentations. The dialogue is really very intense and people are very engaged at the questions, and so you will really see that the issues are strongly debated. And then there's of course an excellent scientific program. I'm really looking forward to the discussion about nocturia as a circadian problem, and then the women's sexual health. I think that is a very evaluated aspect of clinical practice, and I think that will be very important, understanding that and putting it into real life everyday work.
So for physios, we're working really hard to bring you the usual suspects, you know. So obviously we have the physiotherapy forum, but also there are some physiotherapy input in some of the other workshops from ICS. There is the roundtable, and specifically the one about sexual dysfunction, which is led by Mélanie Morin, which obviously sees that physiotherapy is an expert in her field. There is a state-of-the-art, specifically, there is one about sexual dysfunction in men, and there's obviously the dementia and overactive bladder syndrome, and then obviously there's quite a relevant one for physios as well in terms of bladder pain syndrome, which I think we all want to know a little bit more in terms of diagnosis and management.
Within the meeting there's always lots of different things for the nurses to attend. There's workshops often that are dedicated to conservative management, multidisciplinary working. There are state-of-the-art lectures that are often very sort of integral to what we do. But specifically for the nurses, there's also the nursing forum, where all the nurses get together for one session. They talk about things that's particularly pertinent to nursing practice, but also allows a great networking opportunity amongst the nurses from all over the world. The other big thing is to then link in with industry, and there'll always be an industry area where you can go and learn about what's new in the world of devices, medications, that will then help you to bring things into your own practice.
You have the opportunity to speak to colleagues from other continents, colleagues in other specialties, and really understand what the state of the art is.
That's why I love ICS so much, and I will never miss an ICS meeting for the next coming years.